All right, hi guys, very good evening to all of you. Welcome to our today's FAARE class session of second Prof. And today we are going to start and finish the topic that is going to be Autacoids. And before I start the session today, please let me know if I'm clearly audible and visible to all of you guys. Hi, Dr. Tanishk, Gangwar, Dr. Vinay, Tanishk, Cartoon TV. How are you all? Please let me know if I'm clearly audible and visible. Sorry, I was little delayed due to some technical error that I was facing, but luckily the team was able to sort it out. And I was also late because I was traveling. I just reached home also, I mean, a while ago. चलिए बताइए सब कुछ ठीक है? All right, great, चलो ठीक है. So the topic for the day that we are going to do today is going to be histamine and antihistaminic. तो histamine के कौन कौन से antihistaminic ड्रग है? फर्स्ट जनरेशन, सेकंड जनरेशन विल बी कवरिंग. सेरोटोनिन के साथ माइग्रेन, बिकॉज माइग्रेन वाला जो शॉर्ट नोट आता है वो ऑल टाइम फेवरेट एग्जामिनर का. प्रोस्टाग्लैंडिन से रिलेटेड टॉपिक से अक्सर मैंने देखा है स्टूडेंट्स की, है ना, थोड़ी सी परेशानी रहती है. स्टूडेंट का अंदर से रूह कांप जाता है समहाउ, बिकॉज दे डू नॉट रीड, और पढ़ते नहीं है तो आता नहीं है तो परेशान रहते हैं, राइट. तो प्रोस्टाग्लैंडिन को भी क्विकली समराइज कर देंगे और लास्ट में गाउट को भी हम समराइज करेंगे इस लेक्चर में, ठीक है. चलो ऑल राइट, ग्रेट. चलो सो सबसे पहली बात करेंगे हिस्टामिन के लिए. तो लॉन्ग आंसर टाइप क्वेश्चन आएगा. राइट शॉर्ट नोट ऑन हिस्टामिन एंड एंटी हिस्टामिक. नाउ व्हेनेवर यू लुक एट द क्वेश्चन यू हैव टू फर्स्ट ऑलवेज थिंक अबाउट फ्रॉम वेयर कैन आई स्टार्ट एज अ बेसिक. तो उस वो तभी आएगा जब आप थोड़ा प्रैक्टिस करोगे. ऑल द स्टूडेंट दोज हु आर कंटिन्यूसली मैसेजिंग मी ऑल्सो, एक चीज अगर आपने नोटिस किया होगा तो मैं बार बार बोलता हूँ कि ट्राई टू प्रैक्टिस, है ना. लर्न द आर्ट ऑफ प्रैक्टिसिंग, लर्न द आर्ट ऑफ राइटिंग द एमसीक्यू, राइटिंग द दिस ऐसे बेस्ड क्वेश्चन. तो हिस्टामिन के बारे में तो सबसे पहले हिस्टामिन है क्या? इट इज वन ऑफ द अमाइन. हिस्टामिन क्या है? इट्स वन ऑफ द अमाइन. इट इज अ नेचुरली ऑकरिंग इमिडाजोल डेरिवेटिव एंड इज फाउंड फ्रॉम द डीकार्बोक्सिलेशन ऑफ एल हिस्टिडीन. तो जब भी एल हिस्टिडीन देखोगे, व्हेन यू आर गोइंग टू लुक एट द एल हिस्टिडीन, the name of the enzyme that is going to work here is called your histidine decarboxylase. The name of the enzyme that we have here is called your histidine decarboxylase. So because decarboxylation हो रहा है तो histidine decarboxylase यहाँ पे एंजाइम आएगा and with the help of this enzyme histamine will be formed. तो वेरी सिंपल, आपको अगर ये लाइन डायग्राम अगर आपने ड्रॉ कर दिया तो डेफिनेटली इट इज गोइंग टू बी वेरी मच फेवरेबल बाय द एग्जामिनर, राइट. नाउ अब इसके बारे में अगला टॉपिक लिखोगे हिस्टामिन के बारे में, रिसेप्टर के बारे में. तो इफ यू लुक एट द हिस्टामिन के रिसेप्टर, देयर आर गोइंग टू बी 4 डिफरेंट रिसेप्टर ऑफ द हिस्टामिन, 1 2 3 4. इसके रिसेप्टर अलग अलग रिसेप्टर, आई मीन हिस्टामिन जब भी रिलीज होता है अलग अलग रिसेप्टर पे काम करता है. क्योंकि यहाँ पे क्वेश्चन बोल रहा है राइट नोट ऑन द हिस्टामिन, इसके बारे में देखो बेसिक और भी कोई इंफॉर्मेशन मिल पाए तो यू शुड राइट इट डाउन. फॉर एग्जाम्पल इसका सोर्स क्या है? सेल से आता है, जैसे कि मास्ट सेल. अगर आपको याद होगा तो मास्ट सेल डीग्रेनुलेशन की वजह से भी कई बार, अगर मान लीजिए ये मास्ट सेल है तो मास्ट सेल के भीतर भी होते हैं, मैक्रोफेजेस में भी होते हैं. तो मास्ट सेल के डीग्रेनुलेशन की वजह से भी हिस्टामिन रिलीज हो रहा होता है. GIT, enterochromaffin like cell, that is going to secrete histamine that acts on the H2 receptor of the gastric parietal cell. Neurons, reticular activating system यहाँ पे होते हैं and they actually maintain wakefulness. ये क्या करते हैं? ये मेंटेन करते हैं वेकफुलनेस. तो अगर आप अवेक हो, मेरे लेक्चर को सुन रहे हो और समझ भी पा रहे हो, तो यू कैन ऑलवेज थैंक योर हिस्टामिन. आप अपने हिस्टामिन को हमेशा थैंक यू बोलिए. थैंक यू हिस्टामिन फॉर कीपिंग मी अवेक, है ना. नाउ सर्टेन ड्रग्स आर ऑल्सो रिस्पॉन्सिबल फॉर रिलीज ऑफ द हिस्टामिन. जैसे मान लीजिए वैंकोमाइसिन. आपने वैंकोमाइसिन का एक बड़ा फेवरेट सा साइड इफेक्ट सुना होगा जिसको बोलते हैं रेडमैन सिंड्रोम. वैंकोमाइसिन होता क्या है? इनसाइड दिस मास्ट सेल देयर इज एक्चुअली गोइंग टू बी एसिडिक एनवायरनमेंट. और ये मान लीजिए अगर आपको वैंकोमाइसिन है तो दिस वैंकोमाइसिन विल एंटर and it will be trapped inside, or it is going to get trapped inside, and this will actually facilitate and it is going to cause more and more release of the histamine, right. So do remember this. Some drugs like morphine, some drugs like vancomycin, and also D-tuberculine, that is one of the muscle relaxant. This is going to be non-depolarizing muscle relaxant. They are also going to be involved with the release of the histamine. तो सेल हो गया, GIT हो गया, certain drugs are also going to be the source of the histamine. रिसेप्टर, जैसे कि मैंने बताया कि देयर आर गोइंग टू बी 4 रिसेप्टर ऑफ द हिस्टामिन. व्हाट आर दोज रिसेप्टर्स? तो आप उन रिसेप्टर्स के बारे में लिखना चाहें तो आप लिखिए सबसे पहले H1, H2, H3, H4, एज सिंपल एज दैट, 1 2 3 4, राइट? हिस्टामिन 1, हिस्टामिन 2, हिस्टामिन 3, हिस्टामिन 4, 1 2 3 एंड नेक्स्ट इज गोइंग टू बी 4, राइट? अगर आप चाहें तो इसको वर्टिकल में भी लिख सकते हैं, बट आई एम जस्ट राइटिंग इट हियर H1। तो क्विकली यू कैन जस्ट टेल मी दैट हिस्टामिन 1 किसके साथ, इसके बस स्पेसिफिक नेम नहीं होते हैं, इनका बस ऐसे ही नहीं नाम होता है, ठीक है? इनका बस H1, H2, H3, H4, बस ये हिस्टामिन 1, हिस्टामिन 2, 3, 4 ये रिसेप्टर्स हैं। H1 रिसेप्टर, दीज आर ऑल गोइंग टू बी द रिसेप्टर। H1 रिसेप्टर का एक्टिविटी मीडिएटेड बाय GQ, H2 रिसेप्टर का एक्टिविटी मीडिएटेड बाय GS एंड H3 एंड H4 इनका जो रिसेप्टर होता है देयर एक्शन इज मीडिएटेड बाय GI के थ्रू मीडिएटेड होता है। H1 क्या काम करता है, कहाँ पे होता है? H1 इज मेनली लोकेटेड इन द CNS। H1 कहाँ पे होगा? तो इट विल बी लोकेटेड इन द CNS एंड एज आई टोल्ड यू कि CNS में दे आर गोइंग टू डू व्हाट, दे आर गोइंग टू मेंटेन द वेकफुलनेस, दे आर गोइंग टू डू व्हाट, मेंटेन द वेकफुलनेस, right? H1, histamine 1 maintain the wakefulness. Now what about at the blood vessel? They are going to cause vasodilation of the blood vessel, and this vasodilation can also lead to fall in the blood pressure, right? It can also lead to fall in the blood pressure, it can also lead to flushing episode. Apart from that, अगर blood vessel के endothelium की बात करें, so they are also going to cause endothelium contraction. Now you can easily understand, अगर endothelium का contraction हुआ, अगर एंडोथीलियम का कॉन्ट्रैक्शन हुआ तो वो कैसा दिखेगा? फॉर एग्जांपल, अगर मान लीजिए ये ब्लड वेसल है और इस ब्लड वेसल का ये एंडोथीलियम है विद अ टाइट जंक्शन, जब भी इसमें कॉन्ट्रैक्शन होगा तो आफ्टर द कॉन्ट्रैक्शन दिस रेक्टेंगुलर एंडोथीलियम दैट आई हैव शोन हियर इन द इमेज, नाउ दे मे लुक लाइक मोर सर्कुलर बिकॉज ऑफ द ब्लड वेसल कॉन्ट्रैक्शन। आप देखोगे कि एंडोथीलियम के बीच में नाउ देयर विल बी मोर एंड मोर स्पेस। Now, because of the more space in the endothelium, what is going to happen? There are high chances that the vascular permeability is going to be increased. So, endothelial contraction is mainly going to increase. It is mainly going to increase the vascular permeability. It is mainly going to increase the vascular permeability, right? Vascular permeability. All right. रेस्पिरेटरी सिस्टम में क्या काम करते हैं? दे आर गोइंग टू कॉज ब्रोंको कॉन्स्ट्रिक्शन, राइट? ब्रोंको कॉन्स्ट्रिक्शन, रेस्पिरेटरी सिस्टम में ब्रोंको कॉन्स्ट्रिक्शन। नाउ दिस एंडोथीलियम आई एम टेलिंग इट टाइटली पैक्ड, बट बिकॉज ऑफ द कॉन्ट्रैक्शन ये जो टाइटली पैक्ड जो है, नाउ बिकॉज द कॉन्ट्रैक्शन दे विल बिकम मोर सर्कुलर, है ना, नॉट रेक्टेंगुलर शेप जो मैंने यहाँ शो किया है। तो द परमेबिलिटी अल्टीमेटली इज गोइंग टू इंक्रीज। All these histamine release, they are also involved in the different allergies. जितने भी allergies हैं सब में इसमें involve होते हैं। Histamines are also involved with the allergies. Histamine 2 is mainly located, H2 is mainly located at the gastric parietal cell. It is mainly located at the gastric parietal cell. Because they are located at the gastric parietal cell, they are going to secrete the acid. Remember, कभी भी histamine का secretion जब होगा तो they will always and always cause peptic ulcer disease. H3 के बारे में ध्यान रखिएगा कि ये GI मीडिएटेड है, मतलब ये खुद को इनहिबिट करने वाले हैं, ये खुद को इनहिबिट करने वाले। तो देखिएगा हिस्टामिन का रोल ब्रेन में क्या था? अभी किसी ने बोला था थैंक यू हिस्टामिन, अरविंद कुमार ने बोला था थैंक यू हिस्टामिन फॉर कीपिंग मी अवेक। तो हिस्टामिन का रोल क्या था ब्रेन में? कीपिंग यू अवेक, राइट? दैट मीन्स हिस्टामिन नॉर्मली जितना आ रहा था ब्रेन में आना चाहिए, रेटिकुलर एक्टिवेटिंग सिस्टम को एक्टिवेट करके रखता है। लेकिन H3 इट्स एन ऑटो रिसेप्टर। बात को समझिएगा, मैं फिर से क्या बोल रहा हूं, H3 इज एन ऑटो रिसेप्टर, और ये क्या करता है? ये हिस्टामिन के लेवल को जब भी ये H3 स्टिमुलेट होता है, whenever H3 is going to get stimulated, it is going to decrease the level of histamine. ये क्या करेगा? हिस्टामिन के लेवल को डिक्रीज करेगा। आर यू गाइस एबल टू अंडरस्टैंड और नॉट? कि जितने भी ऑटो रिसेप्टर, इतना तो पढ़ाई दिया है आपको कि ऑटो रिसेप्टर अगर स्टिमुलेट होते हैं सो दे आर गोइंग टू सेंड इनहिबिटरी सिग्नल, they are going to send an inhibitory signal, and because of the inhibitory signal by the autoreceptor, what is going to happen? There is decrease in the level of histamine, there is going to decrease in the level of histamine, है ना। फार्माकोलॉजी माय फेवरेट सब्जेक्ट, मेरा भी फेवरेट सब्जेक्ट है आसिफ रजा, ठीक है। अरविंद कुमार, आपकी यूनिवर्सिटी एग्जाम है, मैं बता रहा हूँ जितना भी नोट्स आपको पढ़ाया गया एक बार प्लीज रिवाइज कर लीजिएगा। ट्राई टू प्रैक्टिस द आंसर राइटिंग स्किल्स, और बेसिक से स्टार्ट करेंगे जैसे मैंने यहाँ पे आपको सिखाया है या क्लास में सिखाया है। जस्ट राइट इट डाउन। मैं बता रहा हूँ आपको कि डिस्टिंक्शन लेकर आओगे फार्मा में, उसके नीचे कोई बात ही नहीं होगी अगर आपने सिर्फ क्लास नोट्स को ठीक से रिवाइज कर लिया है और थोड़ा सा प्रैक्टिस कर लिया राइटिंग का। तो ठीक है, तो H3 itself, अगर H3 की बात करेंगे, सो दे आर गोइंग टू डिक्रीज द हिस्टामिन। और H3 का लोकेशन जानते हैं कहाँ पे होता है? CNS में होता है। अब CNS में अगर हिस्टामिन की कमी होगी तो बताइए वेकफुलनेस होगा या सीडेशन होगा? बिकॉज हिस्टामिन वॉज कीपिंग यू अवेक। अगर हिस्टामिन की कमी होगी तो देर इज गोइंग टू बी सीडेशन, देर इज गोइंग टू बी व्हाट? सीडेशन। राइट, क्या होगा यहाँ पे? H3 की वजह से देर इज गोइंग टू बी सीडेशन। मेकिंग सेंस टू ऑल ऑफ यू? इसीलिए ध्यान रखिएगा H3 का एक इनवर्स एगोनिस्ट यूज करते हैं। अब थोड़ा सा ये लॉजिकल लॉजिकल नहीं है, थोड़ा सा कॉन्सेप्चुअल समझना है। H3 itself causing sedation, और H3 का इनवर्स एगोनिस्ट, H3 itself is causing sedation, और H3 का इनवर्स एगोनिस्ट, नेम ऑफ द ड्रग इज गोइंग टू बी टिप्रोलिसेंट, पीटोलिसेंट, टिप्रोलिसेंट, pitolisant. These are the H3 का inverse agonist. तो inverse agonist will always do ulta work, opposite work. Inverse agonist will do what? Inverse agonist is always and always going to do opposite work. Now when H3 is causing sedation, this inverse agonist, they are going to cause what? Wakefulness. They are going to cause what? Wakefulness. And therefore this tiprolisant, pitolisant, these are going to be utilized in narcolepsy का management, right? Narcolepsy का, right, treatment. They are going to utilize the treatment of the narcolepsy. समीर खान सर, मुझे इंग्लिश नहीं आती, कैसे फार्माकोलॉजी को और फार्माकोथेराप्यूटिक्स कैसे अच्छे से तैयार करूं? देखिए, तो एग्जाम से एक दो दिन पहले अगर आप पूछ रहे हो कि इंग्लिश नहीं आती, मेडिकल साइंस में आपको कौन सा सब्जेक्ट हिंदी में समझाने के लिए कॉन्सेप्ट दिया जा सकता है, लेकिन आपको लिखना तो इंग्लिश में ही पड़ेगा डॉक्टर। और मतलब ये तो सवाल ही मतलब मुझे सही नहीं लग रहा है कि मैं कैसे हिंदी में, आप समझने के लिए हिंदी में समझ लो, लेकिन यू हैव टू राइट इट डाउन, यू हैव टू राइट इट डाउन। ठीक है, तो ये हो गया आपके H1 H2 H3 H4, तो ये हो गया H1 टेबुलर फॉर्म, ठीक है, ये वाले H2 टेबुलर फॉर्म। और H4 के लिए डू रिमेंबर दिस, H4 के लिए we do not have any drug for H4. What is known for H4 is that it is located mainly at the WBC and it is involved in the chemotaxis. It is involved in the chemotaxis. That's it. ठीक है, it is involved in the chemotaxis. All right. So this is your H1 H2 H3 H4. अब हम चलते हैं इसके थोड़े से और डिटेल में हिस्टामिन के रिसेप्टर। सो हिस्टामिन 1 is mainly causing what? Wakefulness. It is also involved in the allergies. So what do we do in the management? In the management, we always use H1 antagonist. In the management, we always use H2 antagonist. And H3 का भी antagonist भी use करे, तो not antagonist directly but inverse agonist that is also working like opposite. तो H1 antagonist that we are going to utilize, they will be utilized in many conditions, right? H1 antagonist and H2 antagonist, these are the one that is going to be utilized clinically. They are the one that is clinically utilized. H1 antagonist, H2 antagonist are the one that is clinically utilized. So H1 antagonist, if you are going to look at this H1 antagonist is further going to be divided into first generation and second generation. Now do remember this few important points that I'm telling you. Anyway, you will be receiving the PDF at the end of the ठीक है session. So H1 antagonist, H2 antagonist. Remember, H1 antagonists are the older one. The first generation one are the older one, and second generation one are going to be the newer one. First is old. Always remember, second generation will always have all the good parts. So half life first generation का short to intermediate acting. They have lot of anticholinergic property. They also have blood-brain barrier crossing capacity. Therefore, lot of antihistaminic activity in the brain, lot of sedation. है The only good part for the first generation is that the first generation are less or non-cardiotoxic. As compared to that, if you look at the second generation, these are less to no anticholinergic action, less blood-brain barrier crossing capacity, therefore less sedative, right? But they have longer T half-life. The only thing that you should know that the second generation is mainly associated with the cardiotoxicity. Some drugs have also been banned, like terfenadine, है ना, estemizole. They have been banned because of this cardiotoxicity. ठीक है? बिल्कुल आसिफ आप रिवाइज करिए एंड mnemonic will definitely help you out, but you have to know where to utilize the mnemonic. Sometimes what happened ki my students will remember the mnemonic but they don't remember where to use it. So if you have gone through my mnemonic, it's going to be very very practical. जैसे इंड्यूसर तो आई यूज्ड टू टेल यू द स्टोरी, इंड्यूसर इंड्यूस करके फेल करा देगा, इनहिबिटर इनहिबिट करके इट विल बी कॉजिंग लॉट ऑफ टॉक्सिसिटी. सो every story or every mnemonic has a background, a story behind that. So if you follow that, you'll be able to utilize that as well. Okay. Now coming back again, first generation, second generation. First generation, shorter acting, short to intermediate acting, more blood-brain barrier crossing capacity, more anticholinergic property, more sedative. And second generation, remember the 4-5 point. So even sometime examiner can give you, write down the differences between first generation and second generation. So you see, right now I have written 4 to 5. 4 to 5, यहाँ पे 4 to 5 differences. So one question you have also done here. On the other hand, you also have to write, their examples. You also have to write their examples. First generation के जैसे कि example में बोलूँ, we can write example like promethazine. Second generation का example if I say, you can write example like let's say levocetirizine, fexofenadine, ओलोपैटाडीन, बहुत सारे हैं, एस्टेमिजोल, टर्फिनाडीन, है ना, सेटरिजीन. सेटरिजीन इज द सेकेंड जनरेशन वन, है ना, आपका अपना फेवरेट. ऑलराइट. So antihistaminic drug, if you're going to look at the first generation, second generation, अब first generation वाले drug कौन कौन से हैं? Let us write down few example. Let us write down few example of the first generation. The first generation example are going to be drugs like the drugs that we are having here are going to be some example only you have to write. You don't have to remember all of them. Remembering all of them is not required. Some of them are going to be drugs like let's say chlorpheniramine. It is going to be chlorpheniramine. There is a very shorter acting chlorpheniramine. Then we are also having drugs like your pheniramine, chlorpheniramine, pheniramine, doxylamine, which is available in the market by the name of doxinate. Morning sickness ke liye is the drug of choice, doxylamine. Then we also have other drugs like your promethazine. So see, if you have written just these 3-4, that should be sufficient. But the more you write, the more the merrier. It's never going to harm depending on how many marks the question has, right? Buclizine, cyclizine, these are going to be the first generation one. Second generation one are going to be drugs like your olopatadine, L-caftadine, olopatadine, L-caftadine. So these are going to be olo, ocular wala, A se aankhon wala, available as an eye drop for allergic conjunctivitis. Allergic conjunctivitis. Then we also have cetirizine. Although cetirizine is a second generation agent, but they are the isomer of the first generation. Remember what I'm saying, and I'll repeat again. Cetirizine is which generation? First generation or second generation? Cetirizine is one of the second generation, but they are the isomer of the first generation agent. And therefore, cetirizine is also causing sedation, and we have an isomer of cetirizine, which is called your levocetirizine. Levocetirizine is actually less sedative. Okay? Then we also have, as I told you, estemizole. These two drugs, estemizole, terfenadine, they have been banned because of the QT prolongation. They are causing QT prolongation, and because of that they have been banned. They are clinically not used. And last but not the least is going to be fexofenadine. Fexofenadine. कल FMG का एग्जाम था. I mean on Saturday, not yesterday, but on Saturday there was exam of FMG. In that they asked which of the following is antihistaminic drug that will be utilized for a person who is on antihistaminic drug causing sedation. So which is least sedative? So fexofenadine is going to be overall least sedative. Overall least sedative antihistaminic drug. So this was the correct answer for that question. Overall least sedative. Okay. You can approach me on any of the social media platform. You can search for me on the Telegram and also on the Instagram. You can easily find, right? So these are going to be the first generation, second generation. So very easy. Pheniramine, chota acting, chlorpheniramine, chota acting. Then chlor को हटा दो तो pheniramine. Then we have 2-4 घंटे चलने वाला doxylamine, right? Promethazine, buclizine, cyclizine, right? Then we have olopatadine, L-caftadine, cetirizine, estamizole, terfenadine, fexofenadine. All these are going to be the second generation. So just few names only you have to write, right? Few names only you have to write. You don't have to write all of them. Important uses of antihistaminic, because you're writing short note on histamine and antihistaminic. So they are used in allergy, motion sickness, right? Motion sickness matlab someone who is going on a journey, let's say car, bus. You have seen someone who is starting the journey and after 15-20 minutes they start to feel nausea and vomiting. है ना? तो just prior to the journey, at least 4 to 6 hours prior to journey, we have to give this promethazine diphenhydramine. Promethazine is one of the antihistaminic drug. This promethazine, it is the first generation antihistaminic drug with maximum antihistaminic and maximum anticholinergic property. Maximum anticholinergic property and maximum antihistaminic property. That is going to be your chota acting chlorpheniramine. Sorry, promethazine very pro, है ना? And that is why we can utilize them in motion sickness also. So motion sickness में इसको use कर सकते हैं, diphenhydramine को भी use कर सकते हैं. Motion sickness में we can utilize them, right? Hydroxyzine, because first generation is mainly causing sedation. उसका side effect क्या होगा? Sedation. Why sedation? Because histamine is keeping you awake. If you block, there will be sedation. Because of the anticholinergic action, there will be blurring of vision, dryness of mouth, urine retention, and constipation. ठीक है? So therefore they are going to utilize in any person who is requiring constant attention, like students, truck driver, aeroplane drivers, जिसको इंग्लिश में pilots बोलते हैं, heavy machine operators. So we do not use the first generation in, right? This is actually going to be the antihistaminic drug first generation का side effect of mainly the first generation. So to counter this one, what do we prefer? In these, you are going to prefer what? Second generation. What will you prefer? You will be preferring what? The second generation one. Okay, you are going to prefer the second generation one, right? Like for example, fexofenadine, and these are the second generation one. Second generation one, olopatadine, fexofenadine, right? Allergic conjunctivitis, मैं यहाँ पे कॉल लिख दे रहा हूँ. C sickness में buclizine, cyclizine we can use, and allergic conjunctivitis में भी also we can use topical olopatadine, L-caftadine. Ocular के लिए olopatadine, ocular के लिए, right? So any kind of allergy you can definitely utilize that. H1 sorted, H2 mainly located at the gastric parietal cell, and अभी मैंने क्या बताया? They increase acid secretion. So we use H2 blocker like ranitidine, famotidine, nizatidine. So these are very easy to remember. Tidine, right? So all this tidine are going to be H2 blocker. They are utilized mainly in the peptic ulcer disease. Cimetidine is also one of the tidine that is clinically not used because of the side effect like gynecomastia. So it will give you the gift of gynecomastia, and also it will be very potent enzyme inhibitor. Therefore, there will be lot of drug interaction. So tidine, एक problem. A H2 blocker है that is going to be utilized in peptic ulcer disease. But remember, cimetidine is clinically not utilized because of the gynecomastia and lot of drug interaction. S3, I have already told you, triptolysine, pitolisine, because S3 itself causes sedation. So inverse agonist we will be using, that is going to maintain the wakefulness. So we are going to utilize them in narcolepsy. Although the drug of choice for narcolepsy is going to be modafinil, that's a different story. But S3 ka inverse agonist, triptolysine, pitolisine is going to be utilized. Because you have to write a short note on histamine, you can also write Histamine release inhibitor. From where, from which cell histamine was getting released? That was your mast cell. Which cell? Mast cell. So if mast cell is secreting lot of histamine, that will be possibly associated with lot of allergic responses. So we can actually give mast cell stabilizer so that we can inhibit the histamine secretion. Mast cell stabilizer like sodium chromoglycate, sodium chromoglycate, है ना, सोडियम नीडोक्रोमिल एंड कीटोटिफेन, है ना, क्रोमोग्लाइकेट, क्रोमोग्लाइकेट, राइट, नीडोक्रोमिल, राइट, नीडो, नो मत जाओ, नीडोक्रोमिल, कीटोटिफिन, फिर से आ गया, कहाँ जा रहे हो, राइट, मास्ट सेल स्टेबलाइजर, दे विल नॉट अलाउ द सिक्रीशन, दे विल नॉट अलाउ द रिलीज ऑफ द मास्ट सेल, दे विल नॉट अलाउ द रिलीज ऑफ द मास्ट सेल. Sameer, we do it in 1.5 hour, बट यहाँ पे टोटल सेशन ही 1.5 आवर का, पूरा ऑटोकॉइड्स 6-7 आवर्स का होता है. मेडिकल कॉलेज में अराउंड 15-16 आवर्स का होता है, बट वी ट्राई टू फिनिश इट हियर इन 6 to 7 आवर्स. So I hope it is clear here. So mast cell stabilizer, nidochromic sodium, ketotifen sodium, sodium chromoglycate, right? So that is going to be considered as the safest antihistaminic drug. They inhibit mast cell degranulation. They do not allow the secretion of histamine from the mast cell because mast cell degranulation causes histamine release. So this is the first one. Okay? This is the first one. So we are done with the first one. First question is sorted. Next question is going to be about a note on serotonin and anti-migraine drug. Now, examiner can ask you any kind of question, right? Like for example, write a note on migraine, write a note on serotonin H5HT1 receptor. Like that kind of question examiner can ask you. Okay? Now remember, like your histamine, this serotonin is also one of the Autacoids. It's also one of the Autacoids, serotonin. And from where is this serotonin derived? Serotonin is one of them. It's an Autacoids that is mainly derived from tryptophan. इसको बोलते हैं that serotonin also, it is an amine derivative. It is an amine derivative. अगर आपको मौका मिल जाए तो अगेन नेवर स्किप फ्रॉम मेकिंग अ लाइन डायग्राम, राइट, नेवर स्किप फ्रॉम मेकिंग अ लाइन डायग्राम. सो यू सी this is the line diagram that you are going to make. Tryptophan, I hope it is visible clearly to all of you. Tryptophan, with the help of tryptophan hydroxylase, it is converted to 5-hydroxytryptophan, which we call it as a 5-HT, 5-hydroxytryptophan. Next is going to be enzyme aromatic amino acid decarboxylase. So again, decarboxylase enzyme. So this 5-hydroxytryptophan now will be converted to serotonin. 5-hydroxytryptophan will be converted to, right, serotonin. So this is going to be the active form of serotonin, right? This active form of serotonin will have different actions. So again, here also, which enzyme is working? Decarboxylase. It is also which enzyme is working? That is going to be your decarboxylase. Decarboxylase enzyme is working. Now there are multiple derivatives of serotonin. Like for example, your melatonin is one of the derivative of serotonin. Who can tell me what is the derivative of serotonin from the the basis of your first year biochemistry knowledge? फर्स्ट ईयर बायोकेमिस्ट्री नॉलेज बताइए, व्हाट इज द डेरिवेटिव ऑफ सेरोटोनिन? सेरोटोनिन से क्या क्या बनता है? हु कैन टेल मी? मतलब इसके कौन कौन से फॉर्म बनते हैं? सेरोटोनिन से क्या क्या बनता है? एक तो मैंने बता दिया, मेलाटोनिन. Who else can tell me more? Melatonin. What else? Anyone? Very good. Melatonin is done. What else? It will also be giving rise to सेरोटोनिन, मेलाटोनिन, और क्या देगा? बायोकेमिस्ट्री में आपने पढ़ा होगा ना, वन ऑफ द डेरिवेटिव ऑफ सेरोटोनिन इज नोन एज मेलाटोनिन. One of the derivative of serotonin is going to be melatonin. One of the metabolite of serotonin is called 5-hydroxyindole acetic acid. 5-hydroxyindole acetic acid. 5-hydroxyindole acetic acid. ठीक है, that is your serotonin. And once you have written about serotonin, you will also write about the receptors. Now remember, there are multiple receptors of the serotonin, but for the drugs we mainly have 4 receptors, and these are going to be 5-HT1, 5-HT2, 5-HT3. You can just write it out in one each pages, है ना. आप vertical भी लिख सकते हैं इसको. 5-HT1, 5-HT2, 5-HT3, 5-HT4. Now 5-HT1 का activity is mainly mediated by 5-HT1 mediated by GI. 5-HT2 activity mediated by GQ. 5-HT3 activity is mediated by ion channel. This is the only one that act via ion channel or ligand gated receptor. Ion channel receptor. And 5-HT4 is acting by GS. ठीक है. The only serotonin receptor that does not act via G protein is called your 5-HT, right? It's called your 5-HT3. 5-HT1 जो GI की mediated काम कर रहा है, the one that is acting with GI, it's as simple as that. See, if you are going to look at this nerve ending, if it stores serotonin here, there is something called your 5-HT1. Now whenever 5-HT1 is going to get stimulated, what will they do? This 5-HT1, they are going to inhibit the GI inhibitory nature. They inhibit the release or secretion of the histamine. Now when you look at the 5-HT1, it's going to be further subdivided into 5-HT1A and 5-HT1B by D. 1A, 1B by D. This 5-HT1 is mainly located at which particular part of the body? It's mainly located in the CNS, involving the pathophysiology of, they are involved in the pathophysiology of anxiety. They are involved in the pathophysiology of anxiety and also involved of migraine. Anxiety and migraine में they are going to be involved. ठीक है, let us understand how. You see 5-HT1 is further going to be divided into 1A, 1B by D. So 1A का partial agonist, if you use, this partial agonist will always compete with the full agonist. Partial agonist will always compete with the full agonist. है ना? In presence of a partial agonist, the full agonist is always and always going to act as the antagonist. In presence of a full agonist, the partial agonist is going to act as the antagonist. So the 5-HT1A का partial agonists are going to be drugs like your buspirone, drugs that we are having is called buspirone, जेपीरॉन, इप्सापिरॉन. सो दीज आर ऑल एंडिंग विद द रोन. तो ये देते हैं रोने वालों को. कौन रोता रहता है? द वन हु इज इन एंग्जाइटी. एनीवन हु इज इन एंग्जाइटी इज क्राइंग ऑलवेज, है ना. ब्यूस्पिरॉन, जेपीरॉन, इप्सापिरॉन. देयर इज वन मोर न्यू एजेंट कॉल्ड यू फ्लिबांसेरिन. फ्लिबांसेरिन इज अ 5-HT1A agonist and 5-HT2 antagonist. इट इज मेनली यूटिलाइज इन द फीमेल के लिबिडो को इंक्रीज करने के लिए. हाइपोएक्टिव सेक्सुअल डिजायर इन फीमेल, राइट, दैट इज फ्लिबांसेरिन, न्यू ड्रग. Flibanserin, hypoactive sexual desire in female may we can utilize, right? Then B by D. Now try to understand B by D. At the cranial nerve ending of cranial nerve 5, that is trigeminal nerve ending, let us provatriptan, alotriptan, all these drugs are having triptan in their name. They are drug of choice in migraine and acute severe migraine also. What is acute severe migraine? A migraine non-responsive to the first line NSAID. Migraine prophylaxis also we can utilize this as a preferred drug. We can utilize them as a preferred drug in the prophylaxis of the migraine. Remember that. 5-HT2 is mainly involved in the pathophysiology of psychosis. So we give 5-HT2A ka blocker, olanzapine, clozapine, quetiapine. In CNS also I did this. I did give the summary of this all, इंपॉर्टेंट एंटीसाइकोटिक, सबका समरी मैंने आपको दिया था, है ना, ओलांजापिन, क्लोजापिन, क्यूटियापिन. These olanzapine, clozapine, quetiapine, risperidone, these are atypical antipsychotics. We are going to use them as a atypical antipsychotics, है ना. schizophrenia patient में we can utilize. They have lot of side effect like metabolic symptom, mainly like weight gain, insulin resistant, dyslipidemia. These are the main side effect of atypical antipsychotics. So 5-HT1 is involved in the anxiety, 1B by D migraine, 2A antagonist, atypical antipsychotics. This will be mainly utilized for the treatment of the negative and positive symptom of psychosis or schizophrenia. So it can be used for treating both the symptom, atypical antipsychotics. Okay? Atypical antipsychotics. Then we have 5-HT3. 5-HT3 is going to be mainly present at the chemoreceptor trigger zone. Whenever they get stimulated, they cause nausea and vomiting. So we give 5-HT3 ka antagonist, 1 ka partial agonist, which is behaving as an antagonist. 2 का we use partial agonist we use. 2 का we use antagonist. 3 का also we are using antagonist like ondansetron, granasetron, palanosatron. All the drugs, they will have one thing in common, that is going to be setron, dolasetron. They are the drug of choice for all cases of the nausea and vomiting, and chemo-induced nausea and vomiting for the prevention also and for the active treatment also. Okay, prevention also, active treatment also. ठीक है. They are having longest half life up to 40 hours के लिए, and कौन longest है? Palanosatron. Palanosatron is the one that is longest half life. ठीक है. All right. So they are the drug of choice for any nausea and vomiting. 5-HT4 is mainly located at the GIT. 5-HT4 is mainly located at the GIT. It is causing increase in the GI motility. 5-HT4 agonist कौन है which is increasing the GI motility? It is going to be drugs like prucalopride. It is going to be drugs like your prucalopride. ठीक है. This prucalopride is mainly going to be utilized for constipation. ठीक है. Constipation. Now this constipation can be due to anything. Constipation due to, let's say, opioid, constipation due to irritable bowel syndrome, constipation due to diabetic gastroparesis. कहने का मतलब है any underlying cause of the constipation we can utilize 5-HT4 agonist. In serotonin, there is a rule that I always say and I ask you to follow, and I say that this is called rule of 5. Rule of 5 says, guys, that receptor number 1 and receptor number 4. So 1 and 4 become 5. 1 and 4 ka we have to use agonist so that you do not miss in the exam. Iska antagonist, uska antagonist. In exam you do lot of maths and you end up making wrong, right? Then we have receptor number 2 and receptor number 3. So 2 and 3 will become 5. So 2 and 3 ka we always use antagonist. Let me just do a quick review. 1 we divided into 1A, 1B by D. 1A anxiety like buspirone, gepirone. B by D all the triptans that is used in the migraine. Then we are having 2 antagonist, 2 का antagonist use करना है like olanzapine, clozapine, risperidone, that is atypical antipsychotics. 5-HT3 utilized for nausea and vomiting. 5-HT4 that is going to be prucalopride. It is utilized for constipation. There were other drugs also in this group, agent like your cisapride, mozapride, these are actually going to be cisapride, mozapride, they are actually going to be associated with QT prolongation. तो इसको clinically हम use नहीं करते हैं. We do not use them clinically. ठीक है. We do not use them clinically. ठीक है. We do not use them clinically. See 1, 2, 3, 4 है. तो if you have to make 5, 1 and 2 can never be 5, or 4 and 2 can never be 5. Yeah, 3 and 1 can never be 5. It's always going to be 1 and 4 will be 5, 2 and 3 will be 5. So that is what you have to follow. All right. Now, because I have told you that migraine is also one of the topic for the day, let us quickly summarize migraine also. So whenever examiner asks you, write short note on migraine, है ना? Discuss migraine, or they can ask you write a note on write a note on migraine pharmacotherapy. माइग्रेन फार्माकोथेरेपी, इस तरह का क्वेश्चन आएगा आपके एग्जाम में. और दे कैन गिव यू क्लिनिकल बेस सिनेरियो, पेशेंट प्रेजेंटिंग विद द severe headache associated with the photophobia, phonophobia, there is associated also nausea and vomiting, discuss their pharmacotherapy. So there may be clinical scenario also. Now when you look at the migraine is actually a condition where the patient will usually present with the inflammation of the neurovascular bundle, especially for the areas that are supplied by trigeminal nerve, the facial skull. Now this migraine is going to be, patient with migraine can have two type of patient. One is patient coming with the aura, one is patient coming without aura. Now with aura मतलब अपने आने से पहले अपने आने की खबर देने वाला, है ना, aura, है ना. जैसे कि अगर मान लीजिए आपकी शादी हो रही है और आपने शादी में इनवाइट कर रखा है मान लीजिए नूरा फतेही को, तो अब वहाँ पे और पहले से ऑरा रहेगा, लोगों का हुजूम रहेगा, आपने अच्छे से बेहतरीन से स्टेज बना रखा होगा, अच्छी सी लाइटिंग होगी, अच्छी सी म्यूजिक होगी. सो वो नोरा के आने के पहले का ऑरा है ना. विदाउट ऑरा, तो वैसे ही हेडेक, हेडेक आने से पहले कुछ अपना सिम्टम देता है, जिसको हम बोलते हैं फोटोफोबिया, फोटोफोबिया, फोनोफोबिया मतलब लाइट से प्रॉब्लम, फोनोफोबिया साउंड से प्रॉब्लम, नॉजिया, वॉमिटिंग. विदाउट ऑरा मतलब सीधे हेडेक शुरू हो जाता है विदाउट एनी ऑफ दिस. द सिम्टम ऑफ द माइग्रेन, द पेशेंट इज गोइंग टू हैव यूनिलैटरल और बाइलैटरल हेडेक. ऐसा नहीं कि सिर्फ यूनिलैटरल होगा, इट कैन बी बाइलैटरल ऑल्सो. पल्सेटिंग हेडेक विच इज डिसेबलिंग इन नेचर, lasting for 2 to 72 hours. It can be as low as 2 hours and it can go for up to 3 days. May be associated with the nausea and vomiting, photophobia, phonophobia, that is which we are going to call it as aura. Now, what is the exact cause of migraine? Nobody knows. When you look at the migraine ka pathophysiology and you try to understand what is the exact cause of migraine, they say not well understood. But they say that there is possibly going to be the neurogenic inflammation of, there is going to be neurogenic inflammation of cranial nerve 5, and this inflammation actually cause release of inflammatory peptide that is called your CGRP, VIP, substance P, and they actually produce inflammation of the neurovascular bundles. There will be inflammation of, there is going to be inflammation of neurovascular bundles. ठीक है. All right. This neurovascular inflammation will actually end up causing pain in wherever the trigeminal nerve is mainly supplying. Now let us understand this, the pathophysiology, in a very simple manner. Let us say that this is going to be the nerve ending. This is the nerve ending of cranial nerve 5, and this has actually inflammatory peptide, and the name of the inflammatory peptide which is present here is called your CGRP. But there are others as well. For example, we have others, let's say substance P, and we are also having VIP. These are the inflammatory peptides that we have. These are the inflammatory peptides. Now always do remember that the presynaptic pay, there is a receptor that is called 5-HT1D. Recently we also found one more receptor, and the name of this new receptor, I'm going to draw in a different shape, is called your 5-HT1F. All right. Now, whenever these CGRP is going to get released or substance P is going to release, they will be acting at the postsynaptic receptors. And once they act on this postsynaptic receptor, these are going to cause inflammation, and therefore the patient will have pain. These are going to be the receptor of the CGRP. Mainly is always going to be CGRP. Main is always CGRP. Now this 5-HT1B by D को explain करने के लिए I will also tell you that on the blood vessel also, if you look at the blood vessel, there is going to be also a receptor, and the name of the receptor which is present on the blood vessel is called your 5-HT1B. B for blood vessel. Now over this one, what we have is 5-HT1B that is going to cause vasoconstriction. It is going to cause what? Vasoconstriction. 5-HT1B. So whenever you are trying to treat a patient with the migraine, you'll have to give a 5-HT1B by D agonist. Try to understand the fact that when you give the 5-HT1B by D agonist, undoubtedly you have sent an inhibitory signal to these inflammatory peptides. You have sent the inhibitory signal, okay, but at the same time these are also going to act at the blood vessel causing vasoconstriction. Now tell me, if they are going to cause vasoconstriction, the agents that I have just discussed a while ago, उसका नाम होता है 5-HT1B by D agonist. These are all going to be triptans. How many of triptan can you recall by now? How many triptan you can recall by now? Like sumatriptan, rizatriptan, naratriptan, frovatriptan. So these are going to be triptans. These are actually considered as a drug of choice for migraine, which I have already told you in the previous slide as well. Apart from that, remember, is this triptan going to cause vasoconstriction? Therefore, because of this vasoconstriction, they are associated with the vasoconstriction, they can always and always precipitate ischemic heart disease. Ischemic heart disease, let's say MI, they can always precipitate IHD, ischemic heart disease like MI. And that explains the fact that why these triptans are going to be contraindicated in MI patients. Myocardial infarction की history वाले patient में we are going to avoid them. Right? We are going to avoid them. As I told you that we have one more receptor at the presynaptic neuron that is called your 5-HT1F. So these are also autoreceptors. The good news is that these autoreceptors says that I will use all the F. Autoreceptor the presynaptic says I will use all the F and I will not give any F to the blood vessel. They are also having inhibitory action. And these inhibitory action at the 5-HT1F, it says I will not give an F to whom? No F for the blood vessel. 5-HT1F कभी भी blood vessel पे पास नहीं रहेगा. It says I will not give an F to the blood vessel. So what we can use currently is a 5-HT1F ka agonist. A 5-HT1F agonist, think and tell me what will it do? A 5-HT1F, think and tell me what will it do? It will also inhibit the release of the CGRP without causing any precipitation of MI. So the name of the drug here is called your lasmiditan. What's the name of the drug? Lasmiditan. Look at the name, the beauty of the name. ये less MI देता है. Lasmiditan less MI देता है. So this lasmiditan, they actually do not precipitate MI. So they are going to be safe in the MI patient or ischemic heart disease patient. So what we saw that the pathophysiologic side, what are the different drug targets that we can use? In addition to that, because you have to write down the short note on migraine, if you look at the question, that was going to be either discuss migraine or note on the migraine therapy. So you can actually give some important severity classification also, like mild, moderate, severe. If it is lasting for up to dull headache 4 to 8 hours, throbbing distracting headache for up to 24 hours. If it is going beyond 24 hours up to 72 hours, intense disabling in nature, we can call it as a severe migraine. The severe migraine patient are usually going to be bedridden. Mild wale mein there will be minimal or some limitation. The patient is not able to focus, not able to concentrate, right? It interfere with the normal activity but not completely disabling. That is going to be the moderate, but completely disabling bedridden. Itna zyada headache ho raha hai, the patient is not able to do anything. and completely bedridden. So you can also add this classification also. Treatment of migraine according to whether this acute attack or prophylaxis, दो तरह के patient होंगे. One is patient is having headache now and he is saying doctor please do something. The acute attack में we can use NSAIDs. NSAIDs like your naproxen, paracetamol, indomethacin, these are the NSAIDs that we can use. Or triptans. If NSAID doesn't respond, then we can use triptans like sumatriptan, rizatriptan. They are the drug of choice for migraine. They are also the drug of choice for acute severe migraine. These are 5-HT1B by D agonist. These are all 5-HT1B by D agonist. And I told you that additionally we can also use lasmiditan. Less MI देता है. Lasmiditan less MI देता है. They do not precipitate myocardial infarction. Alternative to this is going to be ergot derivatives. Now ergots are also having same activity, 5-HT1B by D agonistic property, and therefore the peripheral vessel ka they can even cause constriction and lead to pleuropulmonary fibrosis, gangrene formation. They can be associated with the gangrene formation. Who is associated with the gangrene? Remember ergot derivative like dihydroergotamine or ergotamine. So ergot derivatives are not commonly used in the management of the migraine. Ergots are not used. So let's repeat. Treatment of migraine, acute setup, if the patient is coming, then we use first NSAIDs like naproxen, paracetamol, indomethacin, any of the NSAID you can use. In non-responsive cases or acute severe migraine, we can use directly triptans also. Or NSAID non-responsive cases also we can use triptans, but they can precipitate MI. Alternative to that we have lasmiditan. They do not precipitate MI. आज के दिन में United States में lasmiditan is preferred by many physicians over triptans. Prophylaxis, we do not want the further future attack of the migraine, so we give the prophylaxis that I will discuss subsequently. Sumatriptan, rizatriptan, zolmitriptan, these are all the triptans. Some important points I have written, not very important, just good to know that these are going to be the triptans for your migraine. For the prophylaxis, the drug of choice is going to be propranolol. If propranolol cannot be used, remember we have other alternative like calcium channel blocker like verapamil, or we have calcium channel blocker like verapamil. And apart from verapamil, we also have one more that is called your flunarizine. We have one more that is called your flunarizine. So flunarizine is a very specific calcium channel blocker, for migraine only. So these are especially going to be utilized if the patient is having history of bronchial asthma, right? They are going to be the preferred in patient with history of bronchial asthma. BA कौन सा वाला? दूसरा वाला. There are certain anti-epileptic drug also that has got approval for the migraine. One of the anti-epileptic drug that has got approval to be used in migraine. All of these are for prophylaxis, going to be topiramate and valproate. One is called your topi पहनने वाला drug, that is topiramate, and another one is called your valproate. Anti-epileptic drugs. In addition to that, tricyclic antidepressant, they are utilized for the neuropathic pain. So this migraine is also going to be a neuropathic pain only. So we have agent like your imipramine, trimipramine. We have agents like your imipramine, trimipramine, trimipramine. They are going to be the tricyclic antidepressant. Then we also have alpha 2 agonist like your clonidine. They are also utilized for the neuropathic pain. Right? Angiotensin receptor blocker, एक hypertension का drug है by the name of candesartan. They have also got their approval for the migraine. Candesartan for the migraine. Another one is going to be anticholinergic, is going to be botulinum toxin. So they have also got FDA approval. Botulinum toxin has also got their FDA approval to be utilized in migraine. They inhibit the acetylcholine release from the presynaptic neuron. And alternatively, we can also use CGRP antagonist. Directly receptor को block कर दो. Some of the CGRP antagonists that are orally used, some of them are injectable use. See, injectable ones are all going to be monoclonal antibodies. Orally are going to be drugs like your rimegepant. Look at the name, rimegepant, 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 ubrogepant, ubrogepant, all cgepant. These are all going to be gepant, rimegepant, ubrogepant, all cgepant. Injectable monoclonal antibody are going to be EFG. EFG is going to be eptinezumab. If you can remember, well and good. eptinezumab, एरेनुमैब, because it is not expected कि इस लेवल का आपको at a level of MBBS आता हो, but if you write, believe me, it's going to create magic. ठीक है? eptinezumab, एरेनुमैब, framazumab, see, all of them are monoclonal antibody, and the monoclonal antibody used on neuron, NE neuron. Framazumab, galcanezumab. So these are all going to be monoclonal antibody, EFG. और जितने भी gepant हैं, all these gepants are going to be CGRP antagonists, orally effective. So they are also utilized for the prophylaxis. So lot of drugs that we have for the migraine. And if you look at this, where did we started? We started migraine, discuss migraine. So सबसे पहले you gave migraine. Basically, there can be two types, with aura, without aura. Right? Symptoms: unilateral headache, which is disabling in nature, pulsating, throbbing in character, associated with nausea, vomiting, photophobia, phonophobia. Then you discuss about the pathophysiology. Make sure you practice this before going to the examination. High chances are there it can be asked. ठीक है? Mild, moderate, severe, different type of migraine. पहले 4 to 8, 8 to 24, more than 24. ठीक है? Dull, non-limitation, throbbing, distracting in nature, interfering with the normal activity, and intense, disabling in nature, keeping the patient bedridden. That is going to be severe. All right. Acute attack, prophylaxis. Acute attack में first NSAID, non-responsive में triptans, non-responsive में we can also add other drugs like ergots. Right. Then prophylaxis, propranolol being the drug of choice, other drugs like anti-epileptic drugs. AED मतलब anti-epileptic drugs, calcium channel blocker, TCAs, है ना, alpha 2 agonists like clonidinol, ARB like candesartan, and anticholinergic drug, right? Acetylcholine को कम करने वाला drug is going to be botulinum toxin. They inhibit the acetylcholine release. तो I always say botulinum बाहर नहीं जाने देगा. किसको? B बाहर नहीं जाने देगा. किसको? A for acetylcholine को. Then CGRP can also be blocked. All right. So this is about your entire migraine. Now I can also take this opportunity very quickly to discuss about the prostaglandins. Prostaglandin का नाम आया है प्रोस्टेट वाला ग्लैंड से निकलने वाला. So for the very first time it was found for the very first time from prostatic secretion. For the very first time it was found from the prostatic secretion. Remember, later on, this was somewhere around 1930 year 1930. ठीक है? The precursor of the prostaglandin is going to be phospholipid. Phospholipid is the precursor. With the help of enzyme phospholipase A2, they will be converted to arachidonic acid, and arachidonic acid is the immediate precursor. Why? Because of the COX enzyme की मदद से they will form prostaglandin, and 5-LOX enzyme के help से they will be forming leukotrienes. So overall precursor is going to be phospholipid, but immediate precursor is always going to be arachidonic acid. Let me show you this image, which you have also seen in your favorite subject pathology. Arachidonic acid से ऊपर क्या था? Phospholipids. There is going to be phospholipids, which is being broken down with the help of phospholipase into arachidonic acid. Okay. Now this prostaglandins that is found, first is prostaglandin G2, then H2. After this prostaglandin synthase, with the help of these, they will be forming other prostaglandin like prostaglandin D2. D के बाद आता है E, तो E2, then आता है F, prostaglandin F2, and then two very important prostaglandin which always act, in opposite to each other, and they counter the action of each other. One is called thromboxane A2. So thromboxane A2 is a prostaglandin also. And we also have one more, that is PGI2 prostacyclin. PGI2, that is prostacyclin, right? With the help of LOX enzyme, leukotriene will be formed. Let's not go into those details. Our topic is prostaglandin. So remember, these two important prostaglandin require our attention right now. Thromboxane and PGI2, that is prostacyclin. Usually this prostacyclin, first I am discussing this only, that we have thromboxane A2 and PGI2. What is the name of the enzyme that is forming prostaglandin? The name of the enzyme is called cyclooxygenase. Remember, the cyclooxygenase is of various type. On the platelet, we mainly have only and only COX-1, right? COX-1 is present at the platelet, and they always cause formation of the thromboxane A2, and this thromboxane A2 will be causing platelet aggregation, right? Platelet aggregation and vasoconstriction. COX-1, it leads to formation of thromboxane A2. In contrary to this, if you look at the prostacyclin, it is going to inhibit the platelet aggregation. So look at this. If this is the platelet aggregation and vasodilatation, the prostacyclin, that is PGI2, and thromboxane A2, they both are in balance. अगर thromboxane A2 बढ़ गया, तो there will be too much thrombus formation, and PGI2 prostacyclin, if there is prostacyclin, there will be too much inhibition of the platelet aggregation. So there can be bleeding also. PGD2 is present on the mast cell. E2 is present at the kidney. So they are going to cause vasodilatation, increase the renal blood flow, right? Intrauterine life may, they are also keeping, if you are going to look at the heart, intrauterine life may, they are also keeping the ductus arteriosus ka patency. So you know, all of you guys are very well aware about the fact that inside the intrauterine, during the intrauterine life, the fetal lungs are not involved in the oxygenation of the blood. The fetus will be receiving oxygenated blood directly from the placenta, right? So in the intrauterine life may, remember this prostaglandin, this keeps the ductus arteriosus open. In the stomach, they keep the proton pump in the inhibited form. They keep the proton pump in the inhibited form. This was also the question that was asked on the Saturday examination, right? How does prostaglandin work in the stomach? They keep the proton pump in the inhibited form, and they're also going to cause bicarbonate secretion, promoting the mucus secretion. So they are actually having protective at the stomach. Stomach pe they are going to be the protective. PGF2, they are mainly causing contraction. They are going to cause what? Contraction of the uterus blood vessel. So smooth muscle mein, they will be causing contraction like bronchoconstriction also. So PGF2 alpha analog is always going to be associated with the bronchoconstriction, and they can always create problem in an asthmatic patient. Let's repeat again. As I said, that we are having, these are the important prostaglandins. The first two prostaglandins that I handle for all of you guys, thromboxane A2 and PGI2. One is with the help of COX-1, there will be formation of thromboxane A2. COX-2 and COX-1, they can cause PGI2 formation, right? Prostacyclin formation. PGD2 is mast cell and CNS. Prostaglandin E2 is causing vasodilatation, renal blood flow को increase करेंगे. Prostaglandin at the heart has a weak inotropic, and in the intrauterine life, they keep the ductus arteriosus in the open form. Stomach में, they are protective in nature, and prostaglandin F2, they are mainly involved in the uterine contraction, blood vessel पे vasoconstriction, respiratory system से bronchoconstriction. So if you look at this is the simple image of the heart here, where right atrium is receiving blood from superior and inferior vena cava. This is actually your superior vena cava. This is actually your inferior vena cava. They are going to receive blood from superior and inferior vena cava. Now from tricuspid valve here, the blood will be coming to the right ventricle. From the right ventricle, where is the blood supposed to go? The blood will be going mainly into the lungs. But try to understand the fact, lungs are not used for the oxygenation of the blood. So left ventricle, when they are going to pump the oxygenated blood, left ventricle, when they are going to pump the blood, some of these oxygenated blood will also be reaching via this ductus arteriosus, via the ductus arteriosus, the blood, some of these bloods via ductus arteriosus will now be reaching to the lungs, providing nutrition and development of the lungs. Now, this ductus arteriosus normally is supposed to close after the birth, right? It's supposed to close after the birth. This patency of ductus arteriosus is mainly maintained due to prostaglandin. Patency is maintained due to prostaglandins. I hope it is making sense to all of you, that whenever there is a pumping of the blood, it will be going to the circulation, and via ductus arteriosus, some of the blood will also be going to the lungs, providing nutrition, essential nutrition and growth developmental factors. So in the CVS, in the intrauterine life, as I told you, prostaglandin keep the ductus arteriosus open, and upon birth, normally in you and me, in everyone, normally it closes. At any point of time, if it remains open, we are going to term it as a patent ductus arteriosus. हम क्या बोलेंगे? Patent ductus arteriosus. And this was also one of the questions that was asked. Patent ductus arteriosus, right? So this patent ductus arteriosus के लिए initial medical management is going to be NSAIDs or COX inhibitor. So they will reduce the supply of the prostaglandin agents like your ibuprofen and indomethacin. Ibuprofen and indomethacin. Multiple prostaglandin analogs are present. For example, misoprostol, dinoprostone. So misoprostol is a prostaglandin E1 analog. They are going to cause cervical ripening. We can use them in labor induction and medical termination of pregnancy. Okay. When you look at the medical termination of pregnancy, the most preferred combination for medical termination of pregnancy is misoprostol plus mifepristone. Misoprostol plus mifepristone. ठीक है, medical termination of pregnancy. MTP is medical termination of pregnancy. Plus, this misoprostol can also be utilized in NSAID-induced peptic ulcer disease. It's a very specific drug for NSAID-induced peptic ulcer disease, because NSAIDs, non-steroidal anti-inflammatory drug, I told you in my previous lecture that NSAIDs, they are the COX inhibitor, and COX inhibitor will decrease the prostaglandin in the stomach. And just now, a while ago, I told you that prostaglandins are protective in nature. Prostaglandins are protective in nature. So misoprostol as a compound, it can be utilized for NSAID-induced peptic ulcer disease, but they are going to be contraindicated in a pregnancy. We are not going to use them during pregnancy because again, they can induce labor. And another reason is that they are associated with the teratogenic effect called Mobius syndrome, where the patient will have abnormality of cranial of 6 and 7. So this is actually going to be your misoprostol prostaglandin E1 analog, PGE1 analog, misoprostol. Okay. Dinoprostone is also utilized for cervical ripening and labor induction. It's also PGE2 analog. Other prostaglandin analog is going to be L-prostadil. L-prostadil, ध्यान रखिएगा, it's also one of the prostaglandin E1 analog. Now, where do we use L-prostadil? So, if we can use them in erectile dysfunction and also to maintain the patency of ductus arteriosus in a transposition of grid arteries. So, in a transposition of grid arteries, which is another congenital defect of the heart, where the heart is mainly receiving, the heart is mainly supplying the major arteries that we have, like pulmonary artery and the aorta. They are transpositioned from their place. For example, look at this. If this is the aorta is connected to the right ventricle, and right ventricle is going to pump the blood, and this deoxygenated blood will be coming to the baby. So this is the earliest to present congenital cyanotic heart disease. Earliest to present cyanotic congenital heart disease. Left ventricle that we have here, they are going to give the deoxygenated blood, oxygenated blood, but this blood that is coming to the left ventricle, they are mainly reaching where? To the lungs. Now always do remember, because the pulmonary artery, it is the pulmonary artery that is mainly connected with the left ventricle. This ductus arteriosus patency is very much required. Why? Because only through this ductus arteriosus, some of the oxygenated blood will be reaching to the aorta, and the baby which was receiving the deoxygenated blood, right? For example, यहाँ से जो आ रहा था deoxygenated blood था. So this is a cyanotic congenital heart disease. Until the surgery is done, we have to make sure that this ductus arteriosus is open, so that when the left ventricle pumps the blood, some of this oxygenated blood can also come to the aorta. वैसे majority of the blood will be coming to the lungs, but some of the blood could also come to the aorta. I hope it is making sense to all of you. Okay. So if you want to maintain this patency of ductus arteriosus, we have to give the drug that is L-prostadil. So L-prostadil, we are going to use it for two conditions which mainly affect our heart. जो दिल तोड़ देता है, दो कंडीशन जो दिल तोड़ देता है. एक कंडीशन which we are going to say to maintain the patency of ductus arteriosus in transposition of great artery. The great arteries are transpositioned from its place, so definitely this is going to be heartbreaking news. दिल तोड़ने वाला न्यूज़ है ये. और एक और दिल तोड़ने वाला जो न्यूज़ है, that is going to be erectile dysfunction. इससे भी दिल टूट जाता है ना? हाँ, मन खराब होगा तो दिल टूट ही जाएगा, right? So you can easily understand. Lubiprostone, it's also one of the PGE1 analog that is going to lubricate. So I say lubiprostone, it is going to lubricate, mainly utilized for chronic constipation. So this is also one of the prostaglandin E1 analog that is going to open the chloride channel. You see, when they open the chloride channel, intestinal luminal chloride channel, there will be chloride influx. Chloride will be coming inside, and because of the chloride that is coming inside, there is going to be passive water drive. Passive water drive, right? Passive water drive है कि नहीं? So lubiprostone lubricate करने वाला ड्रग किसको lubricate करता है ना? कहाँ lubricate करता है? Nothing to do with erectile dysfunction. No, it lubricates your gut, intestine को lubricate करता है, so that you can get relief from the chronic constipation. ठीक है? Lubiprostone. PGF2 alpha analog carboprost for the uterine contraction. We can utilize them in second trimester MTP, but we are not using because of the lot of side effect like anaphylactic shock and cardiovascular collapse. So where are we using mainly? Carboprost is mainly utilized to control the postpartum hemorrhage. Carboprost, and you can easily understand that bronchial asthma we are going to avoid this one. Bronchial asthma we should avoid them. Okay. PGF2 alpha analog ice में they are going to increase the uveoscleral outflow of the aqueous. They will decrease the intraocular pressure by increasing the aqueous ka outflow. Now aqueous outflow that is going to be increased by PGF2 alpha is going to be uveoscleral outflow. They are the best drug for opening a glaucoma. Best for opening a glaucoma, or drug of choice for opening glaucoma, that is going to be PGF2 alpha analog. Latanoprost, bimatoprost, सबके नाम में prost आएगा. Trovaprost, tafluprost, everyone is having prost in the name. Latanoprost, bimatoprost, travoprost, tofluprost, सबके नाम में आता है क्या? Prost है भाई, prost है ना? The thing that is coming is called your prost. Latanoprost, bimatoprost, tafluprost, travoprost. All of them, the name is having prost. And side effect of PGF2 alpha analog is also going to be PGF2 alpha analog. Look at the side effect. That is going to be pigmentation of the iris leading to heterochromia iritis, growth of eyelashes, foreign body sensation, fat atrophy of the orbit leading to enophthalmos, atrophy of the fat हो गया in the orbit, acute uveitis, right? So PGF2 alpha analog का side effect is going to be PGF2 alpha. PGF2 alpha analog का side effect is PGF2 alpha. ठीक है? So overall, let me repeat: prostaglandin E1 analog. The prostaglandin E1 analog is going to be drugs जो मैंने आपको अभी बताया. एक तो मिसोप्रोस्टॉल, डाइनोप्रोस्टॉन, लुबिप्रोस्टोन बताया मैंने, और एल प्रोस्टाडिल बताया. Then we also have PGF2 alpha analog like carboprost that is utilized for the postpartum hemorrhage. Although the drug of choice for postpartum hemorrhage is going to be oxytocin. PGF2 alpha analog is going to be your carboprost, and other PGF2 alpha analog is latanoprost, bimatoprost, tafluprost, travoprost. They are the drug of choice for opening a glaucoma. Okay. PGI2 is mainly causing vasodilatation because prostaglandin was causing vasodilatation, and they will also be causing platelet ka aggregation inhibition. Vasodilatation and platelet aggregation का inhibition. ठीक है? This PGI2 analog are going to be drugs like your epoprostenol, treprostinil, and iloprost. All these drugs are going to be given with the injectable epoprostenol. Look at the name. The name itself contains prostacyclin, prostaglandin, eloprost, either inhalational or injectable route. But we got a very sexy drug which recently got approved orally, and because it's a very sexy drug, why it is so sexy? Because they are available orally. So this PGI2 receptor agonist is going to be Celaxipag orally available. Okay, mainly utilized for grade 4 pulmonary artery hypertension. We are mainly going to use them in grade 4 pulmonary artery hypertension, PGI2 analog. Epoprostenol, T-prostenil, eloprost. Beraprost is one more drug that is utilized orally for peripheral vascular disease, like Raynaud's. Raynaud's we can utilize. Okay? Now one more topic before I end the session today is going to be about NSAIDs. NSAIDs का मतलब होता है non-steroidal anti-inflammatory drug. NSAIDs are going to be non-steroidal anti-inflammatory drug. NSAIDs are going to be non-steroidal anti-inflammatory drugs. NSAIDs. Now, let me just quickly talk about these NSAIDs. If you look at the non-steroidal anti-inflammatory drug, कैसे काम करेंगे? These are also given the name as a COX inhibitor. These are also given the name as a COX inhibitor. So first line, if you want, you can just write down as it is. जो मैंने आपको अभी बोला वही लिख दीजिए कि NSAIDs are actually COX inhibitor. NSAIDs are, these are COX inhibitor used effectively as anti-inflammatory drug. Anti-inflammatory and anti-inflammatory ibugesic and antipyretic. Pain, inflammation and also for the fever. सबके लिए use कर सकते हैं. Pain, inflammation, fever, for all of them you can utilize them. Right? For all of them you can utilize them. This is going to be a non-steroidal anti-inflammatory drugs. The non-steroidal anti-inflammatory drug, they are going to be COX inhibitor, cyclooxygenase inhibitor. COX inhibitor, that is going to be your cyclooxygenase inhibitor. All right. This COX is going to be further of two types. I mean, three types: COX1, COX2, COX3. 1, 2, 3. COX1, COX2, COX3. COX1 is mainly constitutive, normally present in the tissues. Like platelet, they are normally present, involved in the platelet aggregation and vasoconstriction. Stomach, they are involved in the prostaglandin synthesis, having a lot of protective role. So this is going to be your COX1. They are having protective role. COX2 is the inducible that is mainly released upon inflammation. And COX2 mediated can be prostacyclin, PGE2, other prostaglandins that we have. And COX3 is mainly involved in thermoregulation. Remember, COX3 has nothing to do with the inflammation. They do not have any anti-inflammatory role. For example, COX3 inhibitor, if I tell you, like paracetamol, other name of paracetamol is going to be acetaminophen. So this paracetamol, acetaminophen, these are actually analgesic and antipyretic only. They are not anti-inflammatory. Paracetamol, acetaminophen, these are mainly having analgesic and antipyretic property. Okay. Now this COX inhibitor itself are going to be your NSAIDs. NSAIDs are going to be COX inhibitor. So if you are going to look at the COX inhibitor, I can divide the COX inhibitor into, if you're going to look at the COX inhibitor, I can divide these COX inhibitor into non-selective, selective, non-selective, selective COX inhibitors. I just need a blank page. Don't know where will I find here. Look at these COX inhibitors. This COX inhibitor, you can divide them into non-selective COX inhibitor Now this non-selective COX inhibitor, they inhibit COX-1, plus they will also have inhibiting action for the COX-2. Then we also have selective COX-2 inhibitor, the one that was released on inflammation. Selective COX-2 inhibitor. These selective COX-2 inhibitor are going to be agents like your selective COX-2 inhibitor. They inhibit COX-2 only, COX-2 inhibition only. Drugs like your celecoxib, सबके नाम में कॉक्सिब आएगा, एटोरीकॉक्सिब, पैरेकॉक्सिब. Paracoxib is the one that is available with the injectable route. Paracoxib, celecoxib, etoricoxib, paracoxib, these are all going to be the selective COX-2 inhibitor. Now remember, if you saw the platelet here and the platelet ka, there were two important balance that we noted. One is called thromboxane A2 and other one is called prostacyclin PGI2. PGI2, which is mainly occurring or coming from your COX-2, and this one is coming from arachidonic acid with the help of COX-1. Normally there is going to be a balance. But if you do a selective COX-2 inhibition, think and tell me what will happen. If you do a selective COX-2 inhibition, this one will be gone and the level of thromboxane A2 will increase. And this increase in the level of thromboxane A2, don't you think it can cause platelet ka aggregation, vasoconstriction? Because thromboxane A2 ka kaam hi tha vasoconstriction, which I have already taught you in the prostaglandin chapter. When you give selective COX-2 inhibitor, what is the problem that is going to be seen? More platelet aggregation, more vasoconstriction, and therefore these selective COX-2 inhibitor can always cause, or they can always precipitate ischemic heart disease, MI, myocardial infarction, or any other peripheral vascular disease. That is why they are clinically banned in many countries, including United States. Either they are banned or the drug that is only used is etoricoxib. It is available with the black box warning. Black box warning is given to any drug that is very fatal, and it can be given only after taking a proper history and ruling out the MI. Black box warning, right, in MI patients. MI patients may you should not be using. I mean, etoricoxib is the only one that is clinically used, that is in use. In our country, so there are many of them that are under use. We cannot say what is happening in our country, but just remember this important point here. All right. So the non-selective COX inhibitor that is going to inhibit COX-1 and COX-2 both. Non-selective COX inhibitor is going to inhibit COX-1 and COX-2 both. Are going to be drugs like your aspirin, indomethacin, ibuprofen, ketorolac, nimesulide. Multiple drugs are there. Oxaprozine, piroxicam, ketorolac, oxaprozine, mefenamic acid, mainly preferred in dysmenorrhea. ठीक. Aspirin is low dose में they only show antiplatelet action, right, from 50 to 375. Up until now they only show antiplatelet action. The anti-inflammatory role will be seen at a very high dose, which is clinically not used. They are mainly going to utilize for closure of patent ductus arteriosus. ketorolac IV या आई ड्रॉप के फॉर्म में अवेलेबल है, आई ड्रॉप वाला एनाल्जेसिक. Nimesulide is a highly hepatotoxic. It's a highly hepatotoxic. In many countries, nimesulide is banned. Oxaprozine एक नंबर का है, that is having a T half life of around 57 hours. This is the one that is having a T half life of around 56 hours. So oxaprozine and paroxicam almost have similar half life. One is lasting for 56, other one is lasting for your 57 hours. So oxaprozine overall is the longest acting. If you have to choose between the both, which one is the longest acting, it is going to be oxaprozine. Now non-selective COX inhibitor, either selective, non-selective, we can always use them in as an anti-inflammatory. The uses of NSAIDs are going to be Anti-inflammatory drug as an analgesic, especially in pain treatment, rheumatoid arthritis, gouty arthritis, made drugs like indomethacin that is having high selectivity for synovial tissue. Ankylosing spondylitis made. Right? Cancer prevention. Aspirin has shown to have cancer prevention. I have given here as a question mark. That means some studies are in favor of this one. Antipyretic, closure of patent arteriosus, Bartter syndrome, where there is mutation of NAK2Cl and biosynthesis of the prostaglandin is increased, that is going to cause more renal blood flow and causing more diuresis. So therefore, we have to give inhibitor of this. So Bartter syndrome mainly mimics the diuretic use. They mainly mimics diuretic use, you know, like loop diuretic use. So if you give COX inhibitor in Bartter syndrome, the prostaglandin level will be comparatively low. Okay. So analgesic action is mainly locally. They will act as a site of inflammation because they are autacoids. So they will not allow the prostaglandin at the site of inflammation, but they have some central role also. Studies have shown that centrally they are going to decrease the prostaglandin level at the level of spinal cord, and therefore they will decrease the transmission of afferent fibers. Afferent fiber मतलब क्या होता? The fiber which is carrying the information to the cortex, they are rich in, right, at the spinal cord fiber which are rich in the prostaglandins. So if you give a COX inhibitor, the prostaglandin level at the spinal cord will be lesser, and therefore the transmission is going to be reduced. So look at this: analgesic, ankylosing spondylitis, anti-inflammatory, है ना? Rheumatoid arthritis, gouty arthritis, that is arthritis, CA prevention, antipyretic. In all these conditions we can use. Okay? NSAIDs. Aspirin out of them is one of the non-selective COX inhibitor, and this aspirin is mainly having a lot of dose-dependent activity. Anti-inflammatory property, analgesic property is there, but antiplateletally mainly we are going to use them because this anti-inflammatory and analgesic property is seen at a very high dose. 52 at 362 or up to 375 also they will be having antiplatelet activity. And antiplatelet activity is mainly seen due to COX-1 inhibition, mainly due to the COX-1 inhibition. They have shown to inhibit the uric acid excretion, therefore they are also associated with the precipitation of the gout. Aspirin is one of the commonly utilized drugs. They can precipitate gout. They have dose-dependent action, 50 to 362 milligram. They have antiplatelet, 500 to 1 gram analgesic and antipyretic. What is never used is anti-inflammatory. I mean 500 to 1 gram is also on the high side, but remember 4 to 5 gram to kabhi nahi use karte. Okay. Initial doses pe they also inhibit the uric acid excretion like up to 2 gram. Therefore, they are going to be contraindicated in gout patient. But in a very high dose, more than 5 gram pe, they have also shown to increase the uric acid excretion. Now remember, does the aspirin can increase the uric acid excretion? Yes. Aspirin, can it increase the uric acid excretion? Yes, it can. But do we use it for that? No, we do not use it for that because इतने डोज पे पेशेंट को सैलिसिलिज्म वाले सिम्टम आ जाएंगे, एस्पिरिन पॉइजनिंग वाले सिम्टम आ जाएंगे. The patient will have symptom of aspirin poisoning. So aspirin का dose dependent action is seen also on the uric acid and also on the other areas. Uric acid पे low dose में and inhibit the uric acid excretion. Therefore, they will increase the uric acid level and can precipitate gout. More than 5 gram पे they will increase the uric acid excretion. 2 to 5 में variable effect. Sometime increase, sometime decrease. ठीक है. Now the pharmacokinetic property, as I told you, that you will be dividing them into 4 parameters: absorption, distribution, metabolism, right? So they are absorbed orally, and maximum absorption can be seen from the stomach until they are in the stomach. Stomach may they are going to be having more acidic form because they are acidic drug. And you know already from general pharma that if the drug and medium are same, absorption will be better, wider distribution, metabolized in the liver, and excreted renally. Therefore, renal failure you should avoid them. This T half-life of aspirin is around 30 minutes, but the duration of action is going to be around 7 to 8 days, and therefore they are given the name as the hit and run drugs. इनका नाम क्या है? Hit and run drugs. In patient with aspirin poisoning, we say that patient is going to have symptom. क्या symptom आएगा? The patient will have symptom of salicylism. What is the meaning of salicylism symptom? What is the meaning of salicylism symptom? Salicylism symptom is going to be nausea, vomiting, टिनाइटस, कंफ्यूजन, हाइपरथर्मिया। तो अगर कोई बंदा मान लीजिए लंबे समय तक हाई डोज ले रहा है, लंबे समय तक हाई डोज ऑफ एस्पिरिन ले रहा है, सो ही विल हैव सैलिसिलिज्म, बिकॉज एस्पिरिन इज एसिटाइल सैलिसिलिक एसिड, सैलिसिलिज्म वाला सिम्टम, सैलिसिलिज्म वाला सिम्टम। हाइपरथर्मिया, अगर ज़्यादा बॉडी टेम्परेचर होगा तो वाटर लॉस होगा, सो द पेशेंट विल ऑल्सो बी हैविंग थर्स्ट, राइट। तो सैलिसिलिज्म वाला सिम्टम आएगा। Respiratory system, initially because of the stimulation of the respiratory center, the patient will usually have hyperventilation. Now think and tell me, if the patient is going to hyperventilate, the CO2 will be washed out. Now this is a very commonly asked question in viva and also in your MCQ, that what is the outcome of aspirin on the metabolic profile of the patient. So you see, respiratory center stimulation lead to hyperventilation, CO2 washout. So if the CO2 is excessively out of the body, there will be respiratory alkalosis. अगर CO2 ज़्यादा बढ़ जाता है तो respiratory acidosis होता है, but if the CO2 is out, we call it as a respiratory alkalosis. And as a compensatory, now there will be metabolic acidosis. So these are the metabolic actions that you have to remember. Very, very important. Very, very important. The patient is going to have respiratory alkalosis and compensatory metabolic acidosis. But this doesn't end here. If you do not take action here, if there is a continuous exposure, respiratory center will be depressed, leading to respiratory acidosis, and that can even lead to death. So cause of the death could be respiratory acidosis in the prolonged continued exposure to the aspirin. In fact, if the examiner is going to ask you most common cause of death in aspirin poisoning, that is respiratory failure. Respiratory failure is the cause of death. Okay? In aspirin poisoning, remember, there is no antidote. The treatment is going to be forced alkaline diuresis using soda bicarbonate, or we can even use carbonic anhydrase inhibitor like acetazolamide. We can also utilize gastric lavage, and we can correct the metabolic abnormality, dehydration, or जो भी symptom रहेगा, we try to treat the symptom. We try to treat the symptom. Whatever symptom is there, we try to treat the symptom, right? So there is no antidote. Remember that. There is no antidote for aspirin. We have forced alkaline diuresis, and we try to correct the जो भी metabolic abnormality रहेगा, gastric lavage करेंगे, and we will also be doing dialysis. ठीक है? So this is everything about our Autacoids के important points जो भी थे मैंने आपको बता दिया, मैंने आपको एक बार summarize कर दिया. I hope that you guys have learned this, and I hope that you are going to use it for learning, right, and revising. On the app, you can also find the PDF of the FAARE, utilize that and revise your other topics as well. ठीक है? क्लासिफिकेशन के लिए थोड़ा सेल्फ वर्क आप लोग करिए. जो भी क्लासिफिकेशन था मैंने ऑलरेडी क्लास के दौरान आपको ऑलरेडी बता रखे हैं, जो भी क्लासिफिकेशन थे, तो उसको लेकर के सेल्फ से नोट आपको बनाना है. लास्ट मोमेंट में इफ़ यू ऑल डिमांड डिफरेंट टाइप ऑफ स्टफ्स, दैट विल नॉट बी फिजिबल, बिकॉज वी डेफिनेटली हैव बीन वी आर शेड्यूल्ड विद आवर मल्टीपल क्लासेस. तो अभी तो फर्रे सेशन ही का मैं आपको वादा कर पाऊंगा. अगर मैं बोल दूं कि हाँ मैं करूंगा और मैं नहीं करूं, तो आई विल बी रॉन्ग ऑन माई पार्ट. So if the time will permit, I will try. I cannot say absolutely no also. I will try. If the time will permit, I'll just make it for all of you guys. But if the time doesn't permit, जो भी निश्चय बैच मैंने क्लास आपके लिए लिया है, उसमें सब में क्लासिफिकेशन के साथ ही आपको पढ़ाया. प्लीज ट्राई टू प्रैक्टिस विद दैट. ठीक है? आई विल सी इन माई टुमारोज क्लास. कल की क्लास जो है आई थिंक अराउंड 2 PM पे है, इफ आई एम नॉट रॉन्ग. 2 PM इफ आई एम नॉट रॉन्ग, यस. सो कल हम एंटी माइक्रोबियल डिस्कस करेंगे, जिससे बार बार क्वेश्चन आपके एग्जाम में भी रहता है. आई विल सी यू इन माई टुमारोज क्लास. Bye bye. Good night.